Hey guys, this is Dr. Vince over at FTR in Joliet. Again, I'm going to continue with this series of strengthening the hip. So today's exercise that we're looking at is prone hip extension, okay, which is being on your belly, raising your legs up in the air or one leg up in the air. It's a very common exercise to see in physical therapy. It's typically given when a patient is unable to do other exercises that may activate those butt muscles if they may not be strong enough to do those exercises correctly. And so I'll give you the progression that I would typically use in the clinic, and then I'll give you the ones that I prefer to use over the others. So step one is a small range of motion, and it's just laying down on your belly and squeezing your bottom, and then relax. Step two, elevate one leg up into the air, hold 2 to 3 seconds, slowly lower down. Step three, you may see this done with both legs. I'm not a huge fan of the both leg version because if you watch what happens to my back, first one, second one. Okay, so I go into an extended position and ideally I'm trying to minimize other joints helping out or other muscles helping out when I know that I have a muscle that the patient is having trouble activating in and of itself. And activating is even a rough word to use. When they're having trouble performing a motion. Okay, so it's common to see these muscles used, these butt muscles used in what's called a posterior pelvic tilt. And that movement is extremely important for some patients who have back issues. Okay, specifically like a true stenotic lesion that presents both clinically and on the image. They may need to learn how to do that motion. And so I don't want to do the both leg version because it may cause them to go into the opposite direction that we're actually looking to obtain. So just because it may be a good exercise doesn't mean it's a good exercise for everybody, which again highlights the point that you should see a therapist who's well versed in understanding biomechanics, and some are more versed than others. One of the other progressions that you can make, we had talked about before that some of the variables you could change are range of motion, resistance, and stability. So we could change the range of motion by doing an exercise that Louis Simmons made famous. The reverse hyper is what it's called. Okay, Louis Simmons, if you're not familiar, again, those who know my history, I'm an old power lifter. Okay, and so Louis Simmons had a long history of back pain, created this machine. You can do it at home. Okay, again, be seen by your doctor. Come in and see your physical therapist. Make sure that these exercises are safe for you. But again, you just have your legs hanging over the edge, table, bed, chest, doesn't matter what it is, chest like a drawer chest, okay? Elevate, come back down. And again, you can see in my low back region how that goes from being relatively flat to arched up, okay? For some patients that you're trying to avoid the arch, this exercise with both legs may not be the best option. But there is another option where you can do it one leg at a time. Obviously, it doubles the amount of time that it's going to take you to perform the exercise. But when we're looking at motion, motion matters. And if you're going into a movement that we can predict is going to produce your symptoms, we're going to avoid it. Okay? And any good therapist should do that. So we're going to avoid provoking symptoms if we don't have to. Okay? And there are other cases where we may have to provoke symptoms, and we can talk about that later. Okay, one of the other options you can do is do it one leg at a time. So you'll drive one leg as close to the table or chair or chest or bed or whatever it is that you're using, and then elevate the other leg up. This minimizes motion at the low back, and it still hits that hip extension, range of motion, and muscles and movement that we're looking for. And so again, if you watch this position right here, how much movement was there versus there. So those are the variations that you could do. Obviously, you can add weight to this. You could do this over a Bosu ball. I don't know how much it would help doing it over a Bosu ball. Anytime that we're looking to maximize a muscle's ability to produce force, that production of force is going to decrease when you increase the stability or decrease the stability. So to put it in perspective, we have to understand your goal. If your goal is to get stronger, to become more stable, okay, in a specific joint by having that muscle produce more force, then we don't want to do these exercises in a position of instability. So we don't want to do these exercises over a Bosu ball. If your goal is to improve your balance and to improve reaction time, then using the Bosu balls, using the Swiss balls, using these Dyna discs, all of those tools are more important for that patient with that goal. And so again, this is where it's important for you to talk to your therapist and for your therapist to have done a thorough evaluation to determine which one you actually need, because not every patient needs the same exercises. Again, if you have any comments, leave them below. This is Dr. Vince, signing off.